With regard to, we'll start by the varicose veins, I suppose, which are more common perhaps, but not clinically as worrying. A patient and the doctors will usually see the varicose veins, but the scan clarifies if the deep system of veins is healthy. The deep system of veins is more important than the superficial veins because they return most of the blood from the limb. And if they're varicose or leaky or previously blocked, one can't see that from the outside. So a duplex scan is very useful in looking at the deep veins. In people who've had previous treatment for varicose veins, it's very unclear often what's where when veins recur or new veins form. So it's essential for that purpose. And in people who come in with phlebitis, which is clotting of the blood in the superficial veins, it presents as a very sore, tender area under the skin. A proportion of those people have deep vein clots, which are more dangerous, and they need to be scanned to check for that.
So what I'm going to get you to do now is take a deep breath. Yeah. And hold it, push down hard. So you're going to go like this. Hard on. So when you're ready, deep breath. Hold it, push down really hard. Good woman. And relax. Oh, yeah, yours back. When the valves close, there should be no backflow.
Then from the arterial point of view, I suppose there are three main territories in the body that are diseased. The carotid arteries go through the neck and supply the brain. The aorta is the big artery in the tummy that supplies both lower limbs, and obviously the arteries in the lower limbs extend from the groins down to the toes. And people, if they've a problem in one of those areas, they're more likely to have diseased arteries elsewhere. So that means if someone comes to me with a problem in the leg arteries, I will routinely look for a problem in the aorta and for the carotids, because there is an increased risk. So the carotids are scanned by ultrasound. The scan will show the actual wall of the artery. If there's a build-up on the inside causing narrowing, it will show that, and it will measure the velocity of blood flow. And it's like a narrowing in a river. The blood will flow faster through the narrowed bit than through the wide bit. So the degree of increased velocity goes along with the degree of narrowing. And some of those people with very bad carotid arteries are at risk of a stroke, and an operation can be carried out electively to reduce the risk of a stroke. The aorta can become narrowed, but maybe more commonly we look for enlargement where the aorta weakens. It expands bit by bit. It never causes symptoms as it does so. And if it gets too big, bigger than maybe 6 or 7 centimetres, it can burst, and that's usually fatal. Aneurysms tend to run in families. They're more common in men than women. They're more common in smokers, and they're more common in people with arterial disease elsewhere. So one could certainly justify screening all men over 65, even those without arterial risk factors, for aneurysms, because they're not easy to pick up clinically. The good thing is, if a man of 65 hasn't got an aneurysm, he's very unlikely to develop one. So there's a huge reassurance element in it. Then with regard to the lower limbs, one can actually scan the arteries directly, which we do occasionally, but more commonly we measure the blood pressure in the arteries in the legs. And if there's arterial disease, the blood pressure will be reduced. Occasionally the pressure can be normal at rest, and you can miss someone with arterial disease. Then we get them to exercise, and that exacerbates the problem, because the blood supply can't keep pace with the demands of exercise, and the test done after exercising will show a reduced blood pressure. The Mater Private is different because, as I understand it, it's the only hospital in Cork with a vascular lab. That's not to say tests like this aren't done elsewhere, but they're done in a radiology department. There perhaps isn't the same degree of specialisation, and it's more difficult to coordinate tests for patient convenience. So we get a lot of people from, I suppose, the Munster catchment area, West Cork, West Kerry, West South Tipperary, West Waterford. And when they come from far away, based on the GP's clinical details in the referral letter, the scans are pre-booked. So they have the scans done first, and then I see them on the same day to go through the history. I examine them. Scans don't replace clinical examination at all. They're additive things. And at least after one visit, they've complete package. They've, I hope, a good bit of clinical acumen brought to it. We concentrate well and listen to them carefully, and they know what's going on. And maybe there's not very much wrong with them, which is fine. or maybe there's an asymptomatic problem that needs to be watched, or maybe they have a big problem that needs a procedure. But at least they go home knowing that that is the plan. Whereas without a vascular lab, that process could be spread over 3 visits to the hospital. It also gives the GPs quite a lot of, I suppose you could say, ownership of the thing, because I believe what they tell me, obviously, and they're clinicians as well. And, you know, if they're concerned about someone's circulation, then it needs to be investigated. So it's on the basis of their clinical details that we get the ball rolling. I think it's important for patients to ask about the Mater Private if they have concerns about possible vascular symptoms, arterial or venous, because the full range of diagnostic techniques is available. I hope good old-fashioned clinical acumen after years of experience, coupled with a modern, properly equipped vascular lab and a superb technologist. It is all about personnel, and we're really lucky in our staff and their experience in doing this kind of thing every day.